Yes, you. Welcome back. Back to my channel. Today we are doing ASMR cranial nerve exam, but you can close your eyes. Now, I do want to say that this video was inspired by Luna Bloom ASMR, so shout out to them. Now, with all that being said, you know the drill. Go ahead and sit back, relax, and most importantly, enjoy. Alright, perfect. It looks like everything is ready. Are you my next patient? Perfect. Go ahead and come in, love. Make yourself comfortable. Yes, you may have a seat. Today we are doing a cranial nerve exam, correct? Right, but this time you can close your eyes. Us doctors find that when a patient closes their eyes, it really intensifies all the other senses. Yes, it makes for better results when we do the cranial nerve exam. So before we begin, let me go ahead and ask you a few questions, okay? Alright, can you confirm your first and last name for me? Yes. Confirm your date of birth. Good. What insurance are you under, love? Okay. And is there anything I should know before we begin the exam? Nothing with the eyes, nose, mouth, ears. Oh, okay. Yes. I'll keep a lookout for that, okay, love? Alright. Now, we're gonna go ahead and get started. Of course, I would like you to close. Go ahead and close your eyes. Perfect. Are your senses already heightened? Yes, you can probably hear my fingers fluttering a little bit better. But we are gonna skip the ears for right now and start with your eyes since they're already closed. Now, tell me, love, can you still see the light even though your eyes are closed? Good. Now, I want you to tell me when I block the light. This is me blocking the light, and this is me letting it through. So go ahead and tell me when I block it and when I let it through, okay? Alright. Good. Perfect. Good. Perfect. Good job, love. Alright, perfect. You did wonderful. Now, let me go ahead and cover one eye. That way the light doesn't shine through. I already know they're closed, but I want you to tell me when I swing, okay? Alright, so I'm just going to. Good. Perfect. Good. Perfect, love. And the other eye, just going to swing, yes. Perfect. you see the blue light appear? Good. 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 Great, love. Now, I'm gonna turn the lights back on, okay? Alright. That was a fun little experiment. I imagine having your eyes closed really intensifies things, huh? As it should, love. Now, let's go ahead and move on. Move on. Move on to your ears. I think your eyes are pretty good so far. Now, I want you to tell me where do you hear my hands? Is it close or is it far? Is it close or is it far? Starting now, love. Okay. Good. Good. Now, let me know when I stop making hand sounds. We're just going to. Good job, Anne. Great job, love. Some more. Perfect. Good. Let's try something a little bit more subtle. So I have some liquid sounds. I want you to tell me when you stop hearing them, okay? Alright. So we're just going to shake. Good. Good. Perfect. You're doing wonderful, love. Now, tell me which side you hear the liquid sounds. Good. And what about now? Okay, and what about now? Ah, correct. It was the same side. Now, tell me when you stop hearing my voice. I'm just going to gradually just kind of talk a little bit softer, and it's gonna kind of get a little bit faint, and slowly but surely you should stop hearing my voice, and you're just gonna let me know when you. Good, love. Now I want you to tell me reverse. So when you start hearing my voice, okay? So I'm just gonna get a little bit louder, and I just want to know when you start hearing my voice, because I'm gonna raise it slowly but surely, and at this point you should be hearing it, and if you can't hear it, then I'm a little bit concerned. Okay, I was starting to get worried, love, but I'm glad you can hear my voice. Now, tell me, what side am I whispering on? So I'm just going to lean over to this side, and I want you to tell me what side you hear the whispers on. Good, love. And then I'm going to lean over, and I'm just going to whisper softly in your ear very delicately, and I just want to know. Good, love. Perfect, perfect, perfect. So far, so good. We're 2 for 2. Now, we're gonna work our way down to your nose, Now, I'm gonna spray a little bit or mist a little bit, and I want you to tell me what you so slightly. Just give you a moment to breathe it in and really guess what you're smelling. Any guesses so far, love? Okay, deep breaths in and deep breaths out. Okay. Any guesses at all? Alright, well, the mister is kind of faint, so let's move on to something a little bit more concentrated, shall we? I have a scent right here, very concentrated scent. Keep your eyes closed. Close for me, love. And I'm just gonna spray a little bit, okay? Alright. Waft it in. Go ahead and waft it in. It's very concentrated, so I don't have to spray too much. What are you getting? There it is. Banana. You did wonderful. Now, let's work our way down to your mouth. I'm gonna put on some gloves because I am going to be placing something on your tongue for you to taste and tell me what you taste. And I just want to stay sanitary, okay, love? Alright, so I have my gloves right here. Let's go ahead and place them on. Now, before we begin, you're not allergic to anything, right? Nothing came up in the system. Good, I just want to clarify. Go ahead and stick out your tongue for me. Ah. A little bit more, love. Ah. There we go. Now, let me go ahead and get a little taste out for you. And I'm just gonna put a few drops. Stipple, 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 stipple. Go ahead and taste that for me. Oh, love. No. I should have clarified. You're not supposed to swallow right away. You're supposed to kind of aerify it a little bit of. Really get a good taste for it. You know what I'm saying? Like, go ahead, guess what that was. See, you really can't guess it because you didn't aerify it. Breathe in, breathe out. Let those receptors work for you, okay? Let's try again. Alright. Stipple, 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 stipple. Go ahead. Good. And what are you tasting? Coffee. That's amazing. this one is more intense. So we're just going to put a little bit, stipple, 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 stipple. Airify, good. Bubblegum, perfect. Now, no peeking for the next one because it has the label on it. My nurse didn't really take that off for me. I'll talk to them about that, but before the next one, let's cleanse your palette again. Alright. Swish around. Good, good, good. Good. Alright. Do you taste any more of the leftover flavor? Good, love. Alright. And let's just go ahead and stipple, 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 right on that tongue. What are you tasting? Oh, love. Of course you're tasting nothing. Airify it. Peppermint. Perfect. Alright, now the peppermint, I'm sure you don't want it to linger, do you? Oh, you like peppermint? Okay, well let it linger. It's not a problem. Now, love, we're gonna move on to our final thing. And so far, you're doing very well. Even though one smell test was iffy, but if we overlook that, you are acing it. We're gonna move on to your reflexes, reflexes, reflexes. So let me just try to open those eyes. Yeah, press them, close them as much as you can for me. Good. I'm just gonna press, 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 press. Okay, wonderful. Now I'm gonna work my way down to your shoulders, okay? Are you comfortable with me touching you there? Okay, thank you. Now, brace yourself. I'm going to push your shoulders down. Go ahead and try to keep them up. Yes, keep them up and pushing. I'm just pushing with all my might. I'm very weak, so this should be tough for me, okay? Yes, there we go. Just kind of pushing down. Okay, perfect. Now, puff, 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 puff out your cheeks for me. Good, and we're just gonna try to press it together. Up, love. Keep your cheeks out as far as you can. Yes, yes. When I press, you do not retreat, okay? Alright, alright. Okay. Good. Good. Perfect. That's what I like to see. Now, I have my little diagnostic hammer, and I'm gonna tap very lightly. I want you to tell me where I tap, okay? Alright. And I also want your body just to make natural movements. If I tap you on the knee and you feel a normal reflex to kick, go ahead, okay? But not too hard. I'm very close to you. Yes, yes, yes. Okay, so let me just go right here. Where is that? Good, and right here. Perfect, and right here. Stick your elbow out for me. Thank you. Where on your arm? Good, good, and right here. Perfect, perfect, perfect. All the normal reflexes. Now, let's go ahead and do some touching, 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 touching. I have a very broad object, and I want you to tell me when it feels fluffy and when it feels more solid, okay? Alright, so I'm just going to stipple, 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 stipple. How did that feel? Fluffy. And what about this? Stipple, 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 stipple. Hard. Okay, one more time. Stipple, 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 stipple. And what about now? Stipple, 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 stipple. Okay. Stipple, 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 stipple. Alright. Stipple, 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 stipple. Okay. Stipple, 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 stipple. Good. Stipple, 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 stipple. Alright. Stipple, 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 stipple. Good. Stipple, 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 stipple. Alright. Now, I'm going to get a little bit slimmer. Okay, love? Yes, yes, yes. So this is going to be harder to pinpoint. I still want you to tell me fluffy or solid. Fluffy or solid, okay? Alright. So let's just stipple, 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 stipple. Good. Stipple, 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 stipple. so much for making it to the end. It really does mean a lot to me when you watch all the way through. I also wanted to say, if you guys like this video, do not be afraid to hit like, subscribe if you want to see more from me, and turn on your post notification bell. That way you are posted every time I post, of course. Last but not least, I want to shout out my Patreon. I post up to four exclusive ASMR videos on there each and every month. So if you have the means to, and you would like to support the channel, the link to my Patreon will be in the description